Good day everyone! So today me and my partner Curl Ashley Sales will be discussing an important parasitic disease that affects millions of people around the world. The onchocerciasis, or also known as the river blindness, caused by the filarial worm Onchocerca volvulus. This disease is transmitted by bacflies and can lead to severe skin condition and even permanent blindness if left untreated. It remains a major public health concern in many tropical regions. In this presentation, we aim to give you a comprehensive overview of this parasite. Our objectives are to understand its epidemiology, where and how the disease spreads, and to go over the life cycle of the Onchocerca volvulus, to identify its morphologic forms, both in humans and vectors, to describe the clinical manifestation of human infection, to explore the available methods of laboratory diagnosis, and finally, to review the current treatment strategies.
Onchocerca volvulus, a parasitic worm that causes river blindness, affects millions worldwide. Let's explore its epidemiology and geographic distribution. It is transmitted by black flies of the genus Similium, usually found near rivers, and this parasite is endemic in West Africa, particularly in Cameroon, Burkina Faso, and Ghana, as well as in Central and South America. Over 99% of infected people live in Africa and Yemen, while the remaining 1% live on the border between Brazil and Venezuela. In 2023, at least 249.5 million people required preventive treatment. According to the Global Burden of Disease Study, 14.6 million had skin disease and 1.15 million had vision loss due to onchocerciasis. However, there's hope. 5 countries have been verified by World Health Organization as of onchocerciasis: Colombia, Ecuador, Mexico, Guatemala, and Niger. Understanding and addressing river blindness is crucial for global health. Let's work together to eliminate this disease. For the next one, let's explore life cycle of Onchocerca volvulus, the parasitic that causes river blindness. For the first step, a black fly of the genus Simulium bites an infected person ingesting microfilariae. The microfilariae develop into infected larvae within the fly. Next is the infected fly bites another person, transmitting the larva. The larvae mature into adult worms which mate and produce microfilariae. For the step 5, the microfilariae migrate through the skin, causing inflammation and damage. The cycle continues when another black fly bites the infected person, ingesting microfilariae and starting the process anew. Understanding the life cycle of Onchocerca volvulus is crucial for developing effective prevention and treatment strategies. Next is let's explore the morphologic forms of Onchocerca volvulus. For the first one is the microfilariae, the larval stage found in the skin and lymphatic system, measuring 220 to 300 micrometers long. Next one is the adult worm, also known as macrofilariae. These worms reside in subcutaneous nodules, with males measuring 2 to 4 cm and females 30 to 50 cm in length. The adult worms cause the formation of nodules, leading to chronic inflammation and tissue damages. Understanding the morphologic forms of Onchocerca volvulus is essential for diagnosing and treating river blindness.
We will now proceed on how Onchocerca volvulus infect humans. One of the earliest and most common signs of Onchocerca volvulus infection is intense skin itching. This results from the immune response to dying microfilariae in the skin. Over time, repeated inflammation causes thickening and discoloration, leading to what is often referred to as a leopard skin. Onchocercomas or nodules form a few months after infection. These are firm, mobile lumps beneath the skin that house adult worms. Though typically painless, they are a key diagnostic clue and are often found near bony prominences like the iliac crest, ribs, or scalp. The infection can also cause chronic inflammation of lymph nodes, and particularly in the groin and femoral areas. This can result in loss of skin elasticity, leading to a condition known as a hanging groin, which is not just disfiguring but can also cause discomfort. In the eyes, microfilariae can migrate to the cornea and anterior chamber, triggering severe inflammatory responses. Over time, this can progress from conjunctivitis to corneal scarring and even glaucoma. If left untreated, it can result in permanent blindness, which is why onchocerciasis is often called river blindness. In the long terms, patient may develop secondary bacterial infection in areas of compromised skin. Vision loss from ocular damage is another serious complication. The Mazzotti reaction is a potential dangerous response to treatment, especially with diethyl carbamazine or DEC. It typically occurs within a week and includes symptoms like fever, rash, swollen lymph nodes, and more severe signs like tachycardia and hypertension. This reaction can be life-threatening and requires a medical supervision during treatment. Now let's move on to the laboratory diagnosis of Onchocerca volvulus, the parasite responsible for onchocerciasis or river blindness. The primary diagnostic method is the skin nip technique. In this method, small samples of skin are taken usually from the lower limbs, shoulder blades, or hips and placed in a saline. Over time, microfilariae or tiny larval forms of worms emerge from the skin and can be seen under a microscope. This method helps confirm the infection and also indicates the severity based on how many microfilariae are seen. For patients showing eye symptoms, an ophthalmic exam using a slit lamp can detect microfilariae in the anterior chamber of the eye. This is important for preventing permanent blindness. We also have serological tests such as ELISA, which can detect antibodies or antigens specific to Onchocerca volvulus. These are particularly helpful in areas where infection rates are low or in people who may not have visible symptoms yet. PCR testing or polymerase chain reaction is a more advanced method that detects parasite DNA in skin or blood samples and is both highly sensitive and specific. Finally, nodulectomy, the surgical removal of nodules. It can be undone especially when nodules are easily felt under the skin. These nodules often contain adult worms and can be examined for definitive diagnosis. Treatment of onchocerciasis focuses on both killing the parasite and reducing the symptoms. The main drug used is the ivermectin, which is usually given once or twice a year. Ivermectin paralyzes and kills the microfilariae but not the adult worms. This is why the treatment needs to be repeated regularly to keep the infection under control and reduce transmission. For long-term management, doxycycline is also used. This antibiotic targets a special type of bacteria inside the worms called Wolbachia, which they need to survive and reproduce. A 6-week course of doxycycline can sterilize female worms and slowly kills them over time. In some cases, when nodules containing adult worms are easy to access, surgical removal or nodulectomy is performed. This helps reduce the overall parasite load. To manage symptoms like itching or inflammation, patient may also be given antihistamines or corticosteroids, especially during the early phases of treatment when the body reacts to dying microfilariae. So overall, treating onchocerciasis requires both medication and sometimes surgical intervention with ongoing efforts to break the cycle of transmission in endemic areas.